this is an example of treating somebody with the whole body pad as the magnetic sandwich. You have to make sure that the coils are coming into the applicators at the same point in the same direction. So the bottom one and the top one are coming in at the same place. Now, it doesn't matter which end you lay in, because again the coil is pretty uniform throughout the whole applicator. Generally, I recommend that if you're taller or longer than the applicators, that what you should do, if you're doing 2 treatments a day, that in the morning you have your head off, and in the evening you have your head on. And the reason for that is that you don't, sometimes the magnetic field therapy can actually make people pretty sedated, feel too relaxed. And so in the morning you don't always want to be as relaxed. However, if you do have headaches or you do have neck pain, etc., well then do a morning treatment. The other thing is, what you're generally going to do, is, depending on how long you are, you can bring the coil up to your neck. Most people are not going to want to take the body pad over their face. It's not very comfortable to do that. But it doesn't matter whether your feet are in or your head is in most of the time, but you do want to have at least once a day have a head treatment, and once a day have a foot treatment, a feet treatment. If your feet are okay, you basically just don't need to include your feet. All right, and you can hear the clicking. And you might be able to see that there's some movement of the shoulder. So people will sometimes get contractions, they'll feel contractions in their bodies. Unlike other high-intensity PMF systems, which can cause very significant contractions, this whole body pad does not. It can cause muscle contractions, but they're not usually very, very, very strong. You can get significant muscle contractions with the other applicators.